All right, welcome back. Hope everybody got a good little walk in there. Stretch your legs, all that good stuff. For our part two, we are going to focus in a little bit more specifically on the massage therapy field. So by the end of this section, you should be able to name 3 common errors unique to the massage therapy field, explain how to eliminate these errors, which of course is the important part, and to list both indications and contraindications in the practice of massage therapy. All right. So let's get to things. All right, so let's get to it. Now, fortunately, the errors in the massage field are usually minor, rarely life-threatening. That's the primary reason that our professional liability insurance is so affordable. Our top malpractice claim in the massage industry is physical and sexual boundary issues. Okay, so we do want to be mindful of those. We want to be mindful that we're super professional at all times, and that nothing we say or do could be misconstrued as a sexual misconduct act. A lot of that does come down to that communication idea. If you're freely and openly communicating with your patients, then there's less risk of a potential issue. All right. There are still other errors that we can make in our line of work, unfortunately, and as our role in the American healthcare system increases, we want to make sure that we are determining what types of errors could take place in our practice and then how to prevent them. All right. So that's kind of our big goal here, is to look at what could happen and how do we prevent it. The other common places for errors in massage practice, again, according to kind of malpractice claims here, come down to errors of execution or procedural errors. Maybe it is the procedure at a particular spa that at the end of every session, the massage therapist assists the client into a seated position in order to help them get off the table safely. Well, if you're trying to do that and you accidentally expose a patient because you didn't instruct them properly on how to hold that draping above their breast area, then we've got an issue, right? So now we've got a procedural problem that we didn't follow the procedure correctly or it was executed incorrectly. Failure to recognize contraindications. Too often I see that people who have been in the industry for a long time, who have seen a lot of things, therefore dismiss a lot of things. All right. So if a patient comes in and they're feeling unwell and in your head it's like, they're probably fine, it's probably just a cold, they're not contagious anymore, so no big deal, that could still be an issue. That could still be a contraindication depending on how ill that patient actually is. All right, so failure to recognize contraindications is another big one in the massage practice. Misunderstanding or ignoring an individual's scope of practice. Now again, our scope of practice in Florida is quite broad, but it is limited to manipulation of the soft tissue of the human body. So anybody who tries to go in and start doing joint manipulations, those are hard tissue, right? We don't mess with bones. Sometimes bones may pop or crack or any of that while we're taking a muscle through its natural range of motion. That's all good. That's kind of safe in our bounds. But we want to be cautious that we're not doing anything with the intention to, say, realign someone's spine. It's definitely outside our scope of practice. Improper sanitation and hygiene practices. And I feel like this one is really paired well with that failure to employ universal precautions. The two of those really go in together. That we need to maintain a safe and sanitary facility. All right. We are touching lots of strangers in the course of a day. And then we're touching lots of other strangers. All right, so we want to make sure that we are keeping our facilities safe and sanitary, that those linens are getting laundered regularly, that we're washing our hands correctly and frequently in order to keep ourselves and our patients safe. All right, because you never know who that patient is later going to come in contact with, right? If we go back to that failure to recognize contraindications one, if I work on a patient who I assume is no longer contagious because, they're just getting over a cold, But if they're actually still contagious, now they've passed pathogens on to me, and now I'm going to work on 3 more people that day. If one of them is immunocompromised and I now spread that contagion to them, that's a big issue for that immunocompromised patient. All right? So, proper sanitation, proper hygiene, using universal precautions correctly, and then recognizing those contraindications are all going to come in together. The easiest ways to avoid errors in the massage industry is to kind of track along these couple of things. We're going to drill down into each of these in the next few slides, but just as an overview to start out, establishing good record-keeping practices, always checking for contraindications, allergies, or other sensitivities, creating open lines of communication during massage, adhering to scope of practice, providing a safe and clean office space, referring out clients that need further care, and getting clients involved in their care. All right, so all of those are going to help us avoid these errors in the massage practice. So let's look at each one in detail. Establishing good record keeping. Now, we saw in the law section what all kind of has to go into our treatment plan and what all goes into our assessment. We want to work with those not just because it's the law and because it's the rule, but because it helps prevent medical errors also, right? There's a reason that those rules get put into place, and it's to help keep the public safe, all right? Intake forms are one of the easiest ways to prevent issues before they even get going, all right? Intake forms help you find out as much information about your patient as possible, can ask about both past and current medical status. All of that can help avoid a medical error. Every patient should be completing a thorough intake form or an health history form, however you like to call it, before their first appointment, actually in writing before their first appointment. And then I would say at least once a year, you should have them look it over and make sure that all that information is still up to date, all right? What we see too frequently is that an intake form is either not fully completed or it's kind of done half-heartedly, and then it's like, oh, well, it's time for my appointment. I guess I'll just finish that later. Again, we want to have all this health information before we get started so that we can see, are there any potential contraindications, any potential issues, anything we need to stay away from in our massage practice, okay? And then updating it regularly, right? If you are keeping your session notes regularly after every treatment, you might make a note that the patient started a new medication or that they had a recent injury. But if it's kind of lost in the notes and a patient is coming in every single week for a year, that's a lot of notes to review before every single session, every single week, right? So putting those important things back on that intake form, updating that intake form regularly to reflect those changes in medication or injury or any of that, very, very important to keep that updated. All right, session notes, kind of touched on it, back into it. Recording notes about your treatment absolutely helps you remember those past sessions and those changes in health status. Remember to review those previous sessions with the patient before sessions as well. And it can be as simple as, Jerry, the last time you were in, you said that you didn't want the table warmer on because it was a really hot day, that you were having problems with your low back, and that you recently started taking a daily aspirin for your heart condition. Is all of that still true, right? Just double checking. Hey, this is what we worked on last time. This is what you told me last time. Is that still accurate information? Okay. Ask them if there have been health changes since the last session, especially if it's been more than 4 to 5 weeks since you saw them last. It can be easy for people to forget about minor surgeries or changes in medications, and any of those unreported changes could have implications in your session. I have had the personal experience of having a patient come in. I hadn't seen this person in about 3 or 4 months, and I said, any changes to your medical history in the last 3 or 4 months since I saw you? Let's take a look at everything that was on your form previously. No, everything's the same. Got it. And then I went to undrape this person's leg, and I saw a scar that I'd never seen before on this person, and it turns out they had had hip surgery about 8 weeks ago. I totally forgot about it. I don't know how you forget about hip surgery after only 8 weeks, but apparently it happens. So make sure that you're double checking and then verify. All right, and then our last one, as far as our record keeping goes, is going to be our incident reporting. Clearly, nobody wants an accident to happen in their facility, in their establishment, on the massage table, in their treatment room, but it happens sometimes. Accidents happen. You put out a towel on the floor for the patient so that when you're stepping off of the massage table, they don't step on that cold tile floor, but that towel slips, and now they've kind of like fallen to the ground. It happens. So if a patient falls off a massage table, claims that the massage caused them injury, has a reaction to your massage medium, you're going to want to complete some sort of incident form. All right, there are, of course, 100 of them out there. There are lots of different varieties on the internet. I will link one particular incident report from an Australian massage association that I really like. I'll put that in the session notes for today. But you want to make sure that you're completing and filing some sort of incident report while those details are fresh in the memory. Okay, so if a patient slips or falls that day at the practice, we want to have both the practitioner and the patient completing some sort of incident report about the issue. Okay, even if it's just jotting down a couple of lines, but we want to get something down on paper while those memories are fresh, so that if there's a claim later down the line, we can go back to those records. Okay. Similarly to keeping those session notes, if you mention in your session notes that you worked on a patient more aggressively than usual, that the patient asked for deeper pressure consistently and you were comfortable providing it, and then later they come back and say, hey, I was sore for like a week after that massage and I had some bruising and it's your fault because of that massage you provided, well, you've got the notes that say that the patient asked for further deep pressure, and that this was an acceptable plan to both of you, that this was what you were going to do. Again, doesn't necessarily count as a medical error, but in order to cover your butt, you want to make sure that you're keeping all of those good notes on it, that this side effect was expected, and you explained that to the patient. All right, so that's our record keeping practices. Thorough intake forms, thorough session notes, incident reporting as needed. Checking for contraindications. Contraindications, as defined in law, are conditions where the massage may not be appropriate for the client, will not provide benefit to the client, could cause an adverse reaction in the client. All right. Now, there are very few instances when someone should not get a massage at all. Contraindications are broken down into several groups: systemic versus local. Systemic, overall throughout the entire body, that means we're not going to do a massage at all for this person. Local contraindications, far more likely to be seen. That's where we're just going to avoid that one area that is affected. Your local contraindications are things like an acute cut, a sore, an acute injury, a local rash. We're looking at warts, right? Because nobody wants to do that. Athlete's foot, a hernia, an active herpes sore. Some of the local inflammations are going to be local contraindications, especially if it is due to a recent injury. Any undiagnosed abnormal lumps and bumps. All right, if it's undiagnosed, we want to refer them to further care. Localized rashes, let's see what else, poison ivy, poison oak, any of that kind of stuff, want to stay away from. So anything that's potentially contagious but only in a small area, we just want to stay away from that small area. As long as it can be kind of contained in that small area, not a big deal. All right. Your systemic contraindications, however, sometimes these are also called general contraindications, total contraindications, absolute contraindications. You could have heard any of those words. This means that we are going to reschedule the massage entirely until either those symptoms have resolved or until that person is no longer contagious. So if somebody is taking an antibiotic, we want to make sure that they're not coming in for massage until that entire course of antibiotics is completed, because massage does change how your body reacts to medication and we want to make sure that those antibiotics are working correctly, right? We all know that massage therapy improves, which means enhances, the circulatory system, which includes your lymph-vascular system. So if we are flushing all of those pathogens through the body even faster than what the antibiotics can handle, antibiotics aren't going to be able to do their job effectively. Anybody who has a fever, I don't know who would be coming in to have a massage while they have an active fever, but it could happen. Unstable blood pressure or hypertension, whether it's too high or too low, if their blood pressure isn't somehow managed, unstable blood pressure, then we're going to be pausing that massage until they get everything under control. Any infectious or contagious illness or infection, cold, flu, shingles, ringworm, any of that kind of stuff that's going to be very highly contagious that we could easily spread around. Anybody under the influence of drugs or alcohol. This comes to an issue for us in a couple different ways. Again, not just that certain drugs or alcohol can affect the way that your body reacts to massage, either deadening nerves, therefore the patient isn't aware of how much pressure is actually being used, or on the other side of things, heightening sensitivities so that maybe a patient is much more sensitive to pressure or to touch. But then also depending on what they've consumed, you have that issue of boundaries not being as firm. Right? If someone's boundaries are inhibited, if their inhibitions are limited, then we want to be very cautious as far as massage goes because of the innate touch of our practice. So anybody under the influence of drugs or alcohol, we're going to say, nope, we're going to reschedule this massage for later. And any undiagnosed severe acute pain. That is a reason to absolutely refer somebody out to their general practitioner or to at least wait a day until we figure this out. Any sort of recent injuries are also going to kind of go underneath that. So usually the guideline is to wait 72 hours after a recent injury. And again, this is going to kind of depend on what the injury is. If somebody sprained their ankle, you'd probably treat that more like a local contraindication that we're definitely not going to work on the lower leg on that side where they sprained their ankle. But if somebody had like a car crash the day before, that is a systemic issue, right? They probably have some of that whiplash issue happening. The adrenaline is still really high. The cortisol levels are still really high and all of that. So their body's just not going to be reacting in the same way. Their pain tolerances are different. So we just really want to be cautious on that. Surgery is one of those things that, depending on when you went to school and who you were taught by and what other classes you've taken since then, sometimes surgery is a systemic absolute no until 6 weeks later. Sometimes it's a it depends situation. I fall into the it depends camp. All right. I think that there are some surgeries for which you can absolutely still have a massage 2 weeks later whenever you're feeling up to it. Again, you want to be mindful, though, of things like pain medications that they're taking and how that changes their pain tolerance to massage. We want to be mindful of any potential for blood clots post-surgery. All right. We want to be mindful of body positioning, even. Depending on where that surgery site is, it could be uncomfortable for them to lay in either the prone or supine position. We might need to move into a side-lying position or a semi-recumbent position in order to make them most comfortable. All right, so surgery is, it depends. Sometimes it's systemic, sometimes it's local. It depends on the patient. It depends on the surgery site. That can be a whole other course of its own 2 hours. Definitely recommend looking further into that one. And then your last contraindication that you want to look into is your allergies and your sensitivities. All right. Obviously, you want to avoid using any product that a patient claims to be allergic to. Now, whether they are claiming it because they actually are allergic to it or whether they're claiming to be allergic because they're sensitive to it, doesn't matter to us, right? They're saying they're allergic to it. They're saying they're sensitive to something. We're not going to be using that. Having a list of ingredients handy for any massage products that you use, super helpful. And Please don't trust that you're going to be able to read the ingredients on the back of your massage lotion in the dim, dark room of your treatment room. It's probably not going to happen, right? Get an actual printout in a bigger font that's easy to read for everyone. For patients, especially people who have like wheat intolerances, they know all of the different words that get used in place of wheat products, so they can tell if this product is going to be an issue for them. All right. A lot of times, like patients with latex allergies can't use products with shea butter in them because the shea tree contains natural latex. All right. They will know what to look for if they have that kind of allergy. They'll know that shea butter is not the only term that shea butter always goes under. It might be under lanolin or something else, so we want to be mindful of those things. And then nut oils, of course, can be a big issue. Essential oils can be an issue for people, not just that they're allergic to particular essential oils, but people are sensitive to certain essential oils sometimes. Seaweed products, algae products, any of those. For anybody with a shellfish allergy or an iodine sensitivity, we could have an issue there. So make sure that you've got that list of ingredients for any product that you're using and have it printed out in an actual larger print form so that it's easy for people to read. Along the lines of allergies and sensitivities, just a quick note on your laundry soaps. Please make sure that those are hypoallergenic, scent-free as much as possible. If you run a practice that has aromatherapy diffusers kind of always going, if you have like your signature scent for your practice, awesome. I personally love that. However, it's not great for everyone. All right. And I've had the situation happen to me where I love the smell of eucalyptus, so I spritzed my treatment room with eucalyptus, and then the patient walked in and had to immediately back out of the room because she is, of course, allergic to eucalyptus. You saw that coming a mile away, right? So we want to make sure that our treatment rooms are as odor neutral as possible before a patient comes in, and then we can introduce the concept of, would you like to add aroma to today's session? Again, if you've seen this patient before and you know that they love a particular aroma, you know that they're comfortable with your signature aroma, go for it. Just be mindful that if you've got somebody who's really sensitive coming in afterwards, you're going to want to air that room out really well. Okay. So always checking for contraindications, always asking clarifying questions of our patients that, if they say something like, oh, I've just got a little something going on with my toe. Like, well, is that little something going on with your toe a cut, a wart, athlete's foot? Either way, I'm not gonna touch it. All right, so ask those clarifying questions and keep your lights bright enough that you can see any of those open cuts, open sores, anything on the skin that you need to be mindful of staying away from. To that end, creating open lines of communication. All right, let's assume that a patient doesn't realize that she has a bruise on the back of her thigh. Happens all the time. You undrape the leg, you notice the bruise. Again, could be a local contraindication, kind of depends on how severe that bruising is. You want to be able to let the patient know about it. All right. Easy ways to do that are to simply, pause your massage and say, hey, I see that you have a bruise here. Is this still tender? Is it sensitive? Anything like that. If it is tender and sensitive, you let the patient know, okay, I'm just going to avoid working in that area directly. So it might feel a little choppy when I work on this area. If it's not tender and sensitive and you're good to go, no big deal. But at least you've brought their awareness to it. Because again, if they see that bruise tomorrow after their massage, they might blame that bruise on you. Now at least you've called it out in the session. Your massage conversation should be focused on the massage. All right. We don't want to be bringing in conversations about our personal lives, about our social lives, about everybody else who works at the clinic with us. None of that is appropriate. All right. Talking about your client's social life is not going to be appropriate either. We want to keep those conversations to a minimum and keep your conversation focused on your treatment. All right. We want to make sure that we are also checking in regularly with our patients throughout the session. All right. I like to use the verbiage before a session of please speak up at any time if my pressure feels like it's too much, not enough, or if you just need to adjust something. I don't know what to fix if you don't tell me there's an issue. Okay? Now, of course, just saying that doesn't always truly open up the lines of communication for everybody. You know, everyone's got a different threshold of what they think it's okay to say. And a lot of patients look to us as the professionals and think, well, this pressure feels like it's really, really heavy, but they must know what they're doing, right? They're the professional. Well, maybe that pressure wouldn't seem heavy to me as a practitioner, but it feels heavy to the patient. So we really want to be cautious about those things, that we're checking in and that we're looking for those nonverbal signs of discomfort as well, right? The clenching, the wincing, the fidgeting, holding their breath, any of those things. Those signs do not automatically mean that they're uncomfortable, though, right? Somebody could be like really clenching their legs down and really tightening up because they really have to pee, right? It might not be anything about your pressure. It might be something totally different. So simply asking that question of, I notice that your legs are tightening up. Is everything comfortable for you on the table? And leaving it as an open-ended question, not assuming you know what the reason is. All right, so we want to say something like, is everything comfortable for you? Or, are you still comfortable? As opposed to saying, like, is it because my pressure's too heavy? We're going to have to dig out a couple more things there. But then as much as possible, trying to keep these questions open-ended and not questions that they can answer with a simple yes or no. All right. If I'm asking specifically about pressure, right, because pressure comes up all the time. Is this pressure okay for you? Well, either way that the client answers yes or no doesn't really tell me any information, right? Because now I'm still going to have to ask a follow-up question. Is this pressure okay for you? No. It's fantastic. All right, cool. No, it's too light. No, it's too, heavy. Or they might just say, yeah, it's fine. Because a lot of people do, right? A lot of people will just say, it's fine, and not really dig any further than that. And we don't want our massages to just be fine. We want them to be amazing. We want them to be perfect. So asking something more along the lines of, is my pressure too much, not enough, or just right? Offers that client a variety of answers to give and really invites that open communication. All right. Other things to check in about: temperature of the table warmer, any heat packs that you're putting on, any steam towels that you're putting on. I do recommend avoiding using the word hot, as it has those connotations of burning. So something along the lines of like, is the temperature of the towel comfortable for you? All right. Is the table temperature appropriate for you? Working on those kind of things. All right. So with those open lines of communication, we want to try to ask as many open-ended questions as possible. We want to make sure we've got those open lines of, please speak up at any time and encourage that effective communication while keeping the conversation focused on the massage treatment and really on the patient's comfort and awareness of their own body and what's changing, what's happening within their own body during that session. All right, working within scope of practice. As a reminder, Florida Statute 480.033 tells us that massage therapy is the manipulation of the soft tissues of the human body with the hand, foot, knee, arm, or elbow. All right, those are the things we can work on. We can use hydrotherapy, we can use electrical or mechanical devices, we can use chemical or herbal preparations, but our work is focused on the soft tissues of the human body. Okay? Where I see people get a little sticky with this is if they hold multiple licenses and they offer, let's say, skincare advice in the massage session because they also are a facial specialist. All right? So, which I have both of those licenses. I have a facial license. I have a massage license. I can offer both of those services, but unless I've specifically set up that session to be a combined session, which is fantastic, if I'm wearing my massage hat, I want to stay in my massage lane. If I'm wearing my facial specialist hat, I want to stay in my facial specialist lane. If you're a nutritionist, dietitian, yoga practitioner, any of those other things, awesome. Love that. Love how that affects your practice. But unless you've specifically set up that session to say that this is a combined session of all of these things, or these 2 or 3 things that I embody, then we want to make sure that we're staying in the lane of this session that is currently happening. So in the course of a massage treatment, we want to stay under the scope of practice of massage therapy. Okay? No facial services, no physical therapy, no chiropractic manipulations, no mental health counseling, no nutrition counseling, right? We want to stay away from any of that when we're focused on that massage. Schedule a separate appointment for other things, right? Your patient comes in for massage and the conversation drifts to that they've been having some bowel issues and that they're worried about their nutrition. You can tell that patient, hey, I am a, certified nutritionist, and I would love to talk to you about this further at a nutrition appointment. Let's set something up after we get done with this massage session. For now, I can focus on relieving some of those bowel issues with some great visceral work, and we'll see where that gets us, but let's set up a future appointment to talk about your nutritional needs. Easy. All right? We're definitely going to stay away from diagnosing, of course, right? And we want to stay away from anything that sounds like diagnosing as well, because the way that something is interpreted by the patient is not necessarily the words that came out of our mouths. If I notice a mole on a patient's back and I say, I see a mole here, it looks like it might be cancerous, you should probably get it checked out. The words that they heard were, you've got a mole that's cancerous. It's just how the brain works a lot of the time. Now that might not happen 100% of the time, but people who are receiving a massage, they're already in that kind of zenned out state, right? They're not necessarily hearing all the words we're saying, even when we're not saying a lot. So we want to make sure that we are being cautious about how we phrase those things. We can say things like, yeah, absolutely. I noticed that you've got this mole here. You should probably get it checked out. Or, when's your next dermatology appointment? This is one that I think your dermatologist should really take a look at. All right? When the patient asks follow-up questions, as they inevitably do, well, why? Does it look like cancer? You fall right back into that scope of practice. Say, this is as much as I can tell you based on my scope of practice and what I know about the human body. What I know is that this needs to be looked at by somebody with more specific knowledge about this condition. Okay? Same thing, if somebody is coming in with chronic pain, we're not going to say, oh, well, that could be fibromyalgia, or, they've always got this crazy foot pain. You don't want to say, oh, well, that's definitely plantar fasciitis, or, oh, I had something like that and it was plantar fasciitis. We're going to be really careful about the words that we use, okay? Refer them out to a GP or to another physician for that proper diagnosis. As far as prescription, that is also not within our scope of practice. And we want to be mindful when we're talking about our home care with this especially, right? Because it is within our scope of practice to talk to our patients about how they can continue these results at home. That's kind of part of being an effective massage therapist. But we don't want to say, you need to do this regimen of exercises in order to see an improvement in your condition. That falls under that physical therapy scope of practice. That's not going to be us as massage therapists, okay? Prescribing also includes supplements, over-the-counter medications, right? I can't tell a patient after their massage that oh, hey, by the way, I noticed a lot of bruising. You're probably low on iron and maybe you should take some iron capsules. Can't do that. All right. If somebody asks you specifically, I've got this soft tissue injury, should I use ice or heat on it? Technically, we can't tell them one way or the other, right? We could say something along the lines of, many people find that combining heat and ice work best for this kind of pain. And I know that can sound really cagey and kind of sound like a non-answer. But unfortunately, to stay within our scope of practice, it's kind of the verbiage we need to use. Okay? Same thing with, you don't want to tell somebody, you should do these neck stretches twice a day. That can be perceived as prescribing. All right? Instead, we can say things like, I have found when I have similar pain, these stretches work well for me, and I try to do them 2 or 3 times a day. You could try that also and see how it works for you, but I'm just mentioning my personal results. All right. Similar on the prescribing, please do not advise your patients about their medications. All right. If a patient says that, they don't love this new medication that they're on because it's making them feel loopy, please do not tell them, well, just stop taking it. No, please don't tell them to alter their dosage. All right. Any of that can be kind of seen in that same prescribing idea. And of course, we're not going to be prescribing, we're not going to be advising our patients about their medications. Similarly, we don't want to apply any topical medications because this can be viewed as dispensing medication, which is absolutely outside of our scope of practice. We are not pharmacists. We do not get to dispense medication. All right. If a patient brings any products in that they would like applied to their body, personally, I recommend saying no, that you just, for safety reasons, for liability reasons, you can't apply anything that the patient brings in. Not only might you not have a full list of ingredients on whatever container the patient brought in, but you don't know if what's in the container is actually what's listed on the ingredients either, right? So we want to be really cautious about those kind of things. If you do use things like Biofreeze, which simply has a percentage of menthol in it, that's not medication, all right? So we kind of skirt ourselves in on that way, but we don't want to use any actual topical medications on our patients. All right, providing a safe and clean office environment. So this is going to work for not only your treatment room, but also your broader establishment. Hopefully these are things that have already been kind of worked out in your area, but if you're looking at opening up a new facility, or if you're moving into a new space and you're trying to figure out what all do I need to worry about, these are some things to be mindful of. Make sure that your area is well lit and free of obstacles, right? And I know that the majority of our resort spas, day spas out there, like that nice dim lighting. It's like you're in a cozy little cave and you've maybe got a little fireplace or, salt lamps going on one side. While it feels cozy and lovely, it can also be really hard to navigate, especially for our patients with mobility devices, or for our patients who have diminished eyesight. We want to be really careful about all that. So keeping your treatment room free of obstacles, being able to bring the lights up when a patient is first coming into a treatment room and leaving the treatment room so that it is more well lit, and then kind of dimming those lights down during the session so they don't have the bright lights right in their eyeballs. We want to have those options, okay? Avoiding slick surfaces. So this is one of those things where we don't necessarily always want our floors to be like carpeted throughout, because that can be a pain in the butt to clean, and carpets can really absorb odors a lot of times. But those tile floors can be really, really cold, or you can slide on them, right? If I spill some of my massage oil on that floor, I'm just going to slide right across it. So having a non-slip mat down, if you do have a slick floor, so that when the patient is getting on and off the table, they have something to kind of catch them, is perfect. Again, we don't want to just like leave towels laying on the floor because those can create more of a slide. Rugs are great, but we want to make sure they've got that non-stick surface on the backside. All right. Being prepared to accommodate. All right. You don't know what kind of mobility issues every single patient has. Some of them might call ahead to let you know, but you're not always going to have that. All right. So being able to accommodate those who are mobility impaired or sight impaired, having the availability of moving your massage table around maybe so that somebody can get their wheelchair through or get their walker through a little bit easier. If your office has a lot of like cutesy little potted plants all over the place, or rugs that are kind of piled up and it looks very boho, awesome, but that can be harder for somebody who's trying to get along with a walker and is going to end up tripping over that. Okay. Similarly, if your table does not have a hydraulic lift to it, having step stools available for people to be able to get on and off the table safely, all right? And again, that step stool needs to be on a surface that's not going to slide out from underneath them. Elevators, ramps, all of those should already be in as part of ADA compliance. But just be mindful of that just because a facility is technically ADA compliant doesn't mean it's functionally ADA compliant. I have worked in a building that technically had a lift to get to the second floor, but in order to get there, a person would have to go through 4 different doors and kind of snake their way through a bunch of boxes because the lift was in the warehouse. And that doesn't really help us. All right. All right, let's see, moving along. Fire safety. Lots of offices don't permit candles for this reason. Not only for the fire issue, but also their scent could be bothersome to some people. Definitely make sure, though, that you've got a working fire extinguisher, that it's kept up to date. That's part of your annual inspection that happens in your massage establishment anyways. Make sure you know where it is and how to use it. Make sure that you've got smoke alarms available as well. Clearly mark your exits, all of those kind of things, all right? And then have an emergency plan in place that supports all of that. If an issue happens, you need to kind of know who's responsible for calling 911, who's going to make sure that all of the patients are out of all of the treatment rooms, who's going to make sure that all people are out of the bathrooms, that, everyone's accounted for, that all employees are in the right spaces. If you've got a large facility where you've got 20 treatment rooms, that's a lot of people to all hustle out in the time that, you've noticed a fire in the break room or something, okay? Similarly, not everything is, a fire emergency. If a patient has an allergic reaction, if they faint, if they're having difficulty breathing, if they're having chest pains, how would you react? All right? So having the numbers for, obviously, 911, that's an easy one, but just your closest healthcare facility, urgent care, emergency room, poison control is a good one to have on hand. The product companies for all the products that you use, anybody who supplies your oils, your lotions, your creams, your tools, all of those kind of things, having those numbers just in case a patient does have an adverse reaction to a product, that you can call up the company and say, hey, we had a reaction here. We need to know, was this a bad batch? Do we need to throw away our product? Those kind of things. All right. I do highly recommend CPR and first aid for massage therapists. I know it's not required in the state of Florida, but I think it's just a great thing for us to have on hand to know how to react in an emergency and how to tell what an actual medical emergency is, because not all chest pains are a true medical emergency, not all breathing issues are a medical emergency, and we don't want to be calling an ambulance if somebody doesn't actually need one. That's a waste of a lot of paramedics' time. All right, similarly to having your emergency plan is having your mobile emergency plan. So if you're going to be doing mobile massage, if you're going to be doing out-call massage, working out of somebody else's house, working out of, your patient's workplace, or convention centers or any of that, have a plan to keep both you and your patient safe in those situations as well. Again, that includes checking for those slick floors or things that you might bump into or in the course of a massage, right? If you're doing out-call massage, you can get into somebody's space and like, oh yeah, I've got room for a massage table in my bedroom. And you go to look and they've got 3 feet between the end of the bed and the wall. And you're like, that's not even enough table space, let alone space for me to move around the table. So implement yourself a safety protocol there of, how do I kind of get in and verify that a space is going to be enough room for me to set up my massage table. But then if a situation goes sideways, if a patient becomes belligerent or aggressive or disrespectful in some way that feels like a problem, know how to get out, right? Be able to get out of that situation easily, have somebody to call, all of those kind of things. And then your last one is checking your equipment regularly. Get familiar with your massage table, know what it feels like when it's stable. Check all of those knobs every single time. I mean it, every single time. In 2018, I think it was, ABMP actually reported an increase of table collapse claims. All right. So this is an issue that's happening. We want to make sure that this is the thing that we're all checking for so it doesn't happen to us. All right. Clean it, take your pieces and parts apart, clean all of those as best you can. Make sure, look for loose screws, look for loose bolts. Make sure that, everything actually screws on correctly still. Make sure that face cradle hasn't been slammed down so many times that as soon as a patient rests their head in it, it just falls, because that happens after a bit of time, of course. When you do those inspections on your own personal equipment, just kind of make yourself a little checklist, right? Maybe it's just something that, some things you do daily, some things you do weekly, some things you do monthly, and just keep track of it for yourself. Make it a procedure, make it a policy that this is how we take care of our equipment, okay? And it's not just your massage table, right? It's your hot towel warmer, it's your stone warmer, it's your table warmer, any kind of warmer you've got. All of that equipment, especially if it's something that plugs in, can potentially fail. So with things with plugs, we're looking for frayed cords, frayed plugs. We're checking to make sure that our heating elements are still working correctly, that they're coming up to appropriate temperatures, all of that, okay? All right, so in addition to providing a safe and clean environment, we also want to look at universal precautions and pathogens removals. So we want to be careful about this. And we talked on this a little bit in the last section with MRSA, but part of maintaining that clean and sanitary practice is making sure that we're not spreading viruses, bacteria, and fungi around on our tools, our hands, our equipment, okay? Colds, influenza, COVID, spread like crazy, mutate like crazy, all right? Yes, there are more serious infections out there, things like MRSA, but the ones that we see most commonly are still an issue, and we want to make sure that we're keeping our practice as safe as possible. There are 3 decontamination terms that we need to know for this, and those are the 3 levels of pathogen removal: cleaning, disinfection, and sterilization. A lot of times people tend to use these interchangeably. They are not the same thing. They have different meanings. They should be used appropriately, all right? Cleaning means taking off the big chunks, basically, all right? It's removing all visible signs of dust and debris. This is our lowest level of pathogen removal. It's things like wiping down your counters, washing your tools after using them, sweeping, dusting, all of that. We're just reducing the number of germs and bacteria that are kind of on surfaces and getting rid of visible dirt and debris, okay? Cleaning does not fully remove all bacteria. It has no ability to remove pathogens. Washing with soap and water is fantastic. It's great. We want to follow it up with disinfection, all right? Disinfection works best if you've cleaned a thing first, if you've gotten rid of the big chunks before you disinfect. So we want to do cleaning first, we want to wash with soap and water, and then disinfect. Disinfection destroys all the living things except for bacterial spores. Disinfectants we should all be familiar with. We should all be using them in our practice. There are lots of different varieties of disinfectants out there. We've got sprays, we've got wipes, bleach, Lysol, alcohol, any of those kind of things, all right? Make sure that whatever disinfectant you are using in your practice, you are using it appropriately, according to manufacturer stated protocols, all right? If you're not, and you're, supposed to use this wipe and let it sit wet for 30 seconds in order to fully disinfect, and you just kind of wipe it down real quick and let it sit for like 15 seconds, you're not actually doing a good job disinfecting. You're not actually disinfecting anything, and now you've just wasted product. Similarly, we want to make sure that we're disinfecting our linens, your sheets, your towels, any of that kind of stuff. Simply adding a cup of bleach along with your laundry detergent to your hot water cycle disinfects. Easy enough. Wiping down your table, your face rest handle, your stool handle, your towel warmers. The temperature dial on your table warmer is one that I see forgotten quite frequently. Bolsters, doorknobs, light switches, any of that kind of stuff. We want to make sure that at least once a day we are fully disinfecting the entire treatment room. Okay? And then the last level of pathogen removal is sterilization. This is the level that actually kills bacterial spores, and it's really not necessary for us in the massage practice. You might see it in a clinic where you work with skincare professionals, but sterilization really is like an extra level above that we don't really need to worry about. Hand washing, though, very important, and we all have been drilled into us like throughout all of our schooling, I'm sure, as massage students. Hopefully it is a practice that you've kept up with. It's a habit that you've stuck with. Again, please make sure that we are washing our hands effectively, consistently, and regularly. All right? Actually wash them for 20 seconds. Actually get in between your phalanges and all the way up to past your elbows. Get all the way in there. All right? If you have a local contraindication for either a patient, such as an open cut in an area, but they still, want work near that area, you might want to work wearing gloves. If you have any open cuts on your hands, you definitely want to be wearing gloves so that you're not spreading anything to your patients. So sometimes you are going to want to wear either nitrile or vinyl gloves. Nitrile is the more commonly used. They sit really tightly against the skin, and that's going to be key because you want them to sit as close to your skin as possible so the patient doesn't notice that kind of dragging that happens with gloves. And then we want to make sure that we are removing our gloves correctly so that we're not going to be contaminating them. There are plenty of videos out there on the interwebs for that. Please do not reuse your disposable gloves, and after taking gloves off, you want to wash your hands immediately. All right. Okay, our next section here is when in doubt, refer out. You don't know everything. You don't know everything. I don't know everything. None of us knows everything, and that's okay. All right, there are amazing, wonderful healthcare providers out there who are trained to assess differently than we assess. We are very, very good at muscles. Doesn't mean we're amazing at everything else, and that's okay. Stay within your scope of practice and refer out to other practitioners for other issues. I highly recommend keeping just a list of contact information on hand for physicians, acupuncturists, dermatologists, physical therapists, mental health counselors. All of these people can be a great support to your massage practice. All right. As we saw in the law section, we can't ask for kickbacks or referral fees in response to doing any of these referrals, but it is just kind of part of providing the best care for your patient, right? Sometimes the best care we can provide for our patients is to say, I'm not the right practitioner for you. All right. And maybe it's even just your style of massage is not the right style of massage for that patient, and they need to be seeing a different massage practitioner. That's okay too. We're not going to be the right therapist for every single person, and some patients just need a different level of care. So take the ego out of it and recognize that there are other amazing people out there who also can help your patients. All right. Keep those numbers on file, have them available to be able to refer your patients to when they ask about it. All right, and then our last one is getting patients involved in their own care. All right, patients play a huge role in the reduction of medical errors. They have a responsibility to be honest about their current and past health conditions. Hopefully they will be. They should be notifying you of any changes in their health status, changes in their medication. Ideally, if you're seeing them regularly, they should be following that treatment plan, following their home care recommendations. If they're not, figure out why. Try to find a solution. We want to make sure that we are getting our patients involved in their health care, involved in their treatment, so that they understand that this is a partnership, right? For any kind of healthcare professional, we're not going to be able to just perform one treatment and then the patient is magically all better for the rest of their lives. That's not how any of this works, right? We all know that. So we want to make sure that that pre-treatment interview is thorough and that we explain to them why it's important that we do this, why it's important that they're honest with us about their conditions. If somebody doesn't want to share everything at the very beginning, because it can be scary to tell a total stranger your entire medical history and can feel like it's not necessary for just a massage, you want to make sure that we're explaining to them, like, hey, I need a certain amount of information to provide a safe massage treatment for you, okay? During the treatment, we want to be checking in with them, not just about pressure, but where are you feeling this in your body? Are you noticing this referring pain anywhere? Do you start to feel that unwinding happening? All right. Bring their attention to what they're noticing, bring their attention to their bodies so that they can really see how that massage is affecting them. All right. Again, with those home care recommendations, I know that we get a lot of the I don't have enough time to stretch, I don't have time to do that. We can get creative with it, right? If you are standing at the sink brushing your teeth, that is a great time to do some stretches, right? Because you're just standing there at the sink anyways. What else are you doing? So, get your foot up on the counter, do a little light hamstring stretch, get your knee up onto the counter, maybe do a little piriformis stretch there. While standing in line at the grocery store, that can be a great time to just remind yourself, like, oh, no, shoulders back and down, and just kind of do that. Sitting at a traffic light might be a perfect time for a patient to work on their temporomandibular joint issue, right? There's so many downtime moments in our life that we just don't necessarily think about. And that doesn't mean that our day has to be, chock full all the time. Like, it's also important to take rest moments. But we do want to say that, taking the time to stretch doesn't have to feel like it's a thing that, 20 minutes every day before I go to bed, I have to do it exactly like this. They can work in those stretches wherever it works best for them. They can work in those home care exercises wherever it works best for them. All right. And then, of course, the treatment plan follow-up, making sure that they are coming back regularly for follow-up treatments to see, did it work? Did it not work? Do we need to change the plan? Has their home routine changed and therefore their pain pattern has changed? All right. Because remember, a lot of times, you told them that the reason that they're having all of that right shoulder issues because they tend to lean towards that right side when they're in the car. And so now they're shifting over to the left side, but now the left side is all messed up, right? So it just it goes in those waves. So we want to make sure that we're following up on that treatment plan, that they're coming back for more regular visits, kind of as we're planning that out for them. All right, so we've looked at the massage-specific issues here. Common errors unique to the massage therapy field, how to eliminate those errors. We've talked through indications and contraindications in the practice of massage therapy. My one last note on those indications and contraindications is to be mindful of the language that you use if you do need to tell a patient that we absolutely can't do this massage today. If you simply say, sorry, you've got a fever, can't do a massage for you, that doesn't necessarily tell them everything they need to know. That tells them, if anything, that they can schedule with somebody else and simply not tell that other therapist about the fever, and then it'll be totally fine. They can still get that massage. All right. So we want to practice really verbalizing the why behind any of that. And again, this is a great time to have another massage therapist to bounce ideas off of, whether they are a member of a local massage association that you go to their meetings regularly, or if you've just got a couple of peers that you're working with, colleagues at your massage establishment, folks that you went to school with that you're still really close with. Lean on those people. All right. Know that those people are still there for you. We are not competition to each other. We are all here to help the entire industry thrive. And hopefully it will be a much safer practice now that we've learned a little bit more about how to prevent medical errors in the massage industry.